If you are over 60, you have probably spent a lot of time watching your blood pressure numbers. Most of us have been taught that the top number, the systolic, is the one that matters most. And yes, it does matter. But here is something that does not get talked about nearly enough. Your bottom number, the diastolic, is actually telling a quieter and often just as important story about the health of your arteries. And the gap between those two numbers, the difference between the top and the bottom, can tell you even more. I am Dr. Sarah Mitchell, and I hear from so many patients over 60 who are doing everything their doctor asked. They are taking their medication, checking their numbers, watching their salt, and yet something still feels off. They feel dizzy when they stand up. They feel tired in the afternoons. Their readings are not shifting the way they expected. Today, I want to help you understand what is actually happening inside your arteries as you age, why that gap between your two numbers matters so much, and 5 evidence-based natural steps you can take to support your arterial health starting this week. These are not things to replace your medication or your doctor's advice. These are things to understand and things to bring up at your next appointment so you can have a more informed conversation about your own health. Before we get into it, if you are new here, welcome. I am Dr. Sarah Mitchell, and every single week I share health information that actually matters for people over 60. Hit that subscribe button right now and join our community. It is completely free, and it could genuinely make a difference in your health. Okay, let us get into it. Let us start with something most people have never had explained to them, and once you understand it, your blood pressure readings will never look the same way again. Every time your heart beats, 2 things happen. First, your heart squeezes and pushes blood out into your arteries. The pressure created by that squeeze is your top number, your systolic. Then your heart relaxes and refills. During that rest moment, the pressure in your arteries does not drop to 0. Your brain, your kidneys, your organs are still being supplied with blood between beats. The pressure that keeps that blood moving during the rest phase, that is your bottom number, your diastolic. Now, here is the key. Your diastolic pressure is not maintained by your heart. Your heart is resting. It is maintained by the elastic recoil of your artery walls. Think of young, healthy arteries like rubber bands. When the heart pushes blood through, the artery walls stretch to absorb that surge, and then they snap back, pushing blood forward and keeping your organs supplied between beats. That is a beautifully designed system. But as we age, those artery walls gradually become less like rubber bands and more like a stiff garden hose. When that happens, 2 things occur together. The top number tends to rise because the walls cannot absorb the surge from each heartbeat, and the bottom number tends to fall because the walls cannot recoil to maintain pressure between beats. The gap between the 2 numbers widens. Doctors call this gap your pulse pressure, and it is one of the most meaningful indicators of how elastic your arteries actually are. A wider gap generally means stiffer arteries. This is worth knowing and worth discussing with your doctor at your next visit. Now, the natural question is, why do arteries stiffen as we age? And is there anything we can do about it? The stiffening process is partly a natural part of aging. The proteins that keep artery walls flexible gradually shift over the decades. But here is the empowering part. This process is not purely inevitable. Certain lifestyle factors accelerate it. Chronic high blood sugar, persistent inflammation, physical inactivity, and high blood pressure itself. And specific, well-studied habits can help slow it down and support better arterial flexibility over time. Let me walk you through 5 of them. The first is dietary nitrates, and this one surprises a lot of people. Your artery walls are lined with cells that produce a gas called nitric oxide, which signals the smooth muscle in your artery walls to relax and widen. As we age and as arteries stiffen, this natural process becomes less efficient. Certain foods, particularly beets, arugula, and spinach, are rich in natural nitrates that help support this pathway and encourage your artery walls to stay more relaxed. Research has specifically looked at how dietary nitrates affect blood pressure in older adults and found that they tend to support a reduction in the top number without significantly lowering the bottom number. For seniors managing a wide gap between their two readings, that selectivity matters. Aim for 2 cups of raw arugula, 1 medium beet, or a cup of beet juice daily. Raw or lightly cooked is best, as high heat can reduce the nitrate content. One practical note: if you use antiseptic mouthwash regularly, it may be worth discussing with your dentist whether it is necessary for your situation. The bacteria naturally present in your mouth play a role in converting those dietary nitrates into a usable form for your body. Regular brushing and flossing are what your oral health needs. Beyond that, the natural oral environment is actually working in your favor. The second step is magnesium, specifically magnesium citrate. Magnesium plays a direct role in helping the smooth muscle tissue around your artery walls stay relaxed. It also helps prevent calcium from depositing inside vessel walls, which is one of the mechanisms that contributes to arterial stiffening over time. Research looking at magnesium citrate supplementation in older adults found measurable improvements in arterial flexibility after several months of consistent use. A common amount studied is around 350 milligrams daily, taken with a meal in the evening. As always, check with your doctor before adding any supplement, especially if you have kidney concerns, as magnesium is processed through the kidneys. The third step is vitamin K2, specifically the form called MK7. This is one of the most underappreciated nutrients in cardiovascular health for seniors. Here is why it matters. Your artery walls naturally produce a protein whose job is to prevent calcium from depositing inside the vessel wall and to redirect that calcium toward your bones, where it belongs. Vitamin K2 is what activates that protein. Without adequate K2, that protective protein sits inactive, and calcium gradually builds up inside your vessel walls, contributing to stiffening over time. Studies in populations with naturally high K2 intake show lower rates of arterial calcification and more flexible vessels. Supplementation with MK7 at around 180 micrograms daily, taken with a meal containing some fat, since K2 is fat-soluble, has shown promising results in supporting arterial health. One important note: if you are on warfarin or any blood-thinning medication, please speak with your doctor before starting K2, as it can interact with those medications, and your dose may need to be adjusted. The fourth step is potassium through food. Potassium helps your blood vessels stay more relaxed, supports your kidneys in managing sodium levels, and plays a meaningful role in keeping arterial walls flexible. The key word here is through food, not high-dose supplements. Potassium supplements above a small amount can be risky, particularly for seniors or anyone with kidney concerns. But potassium through whole foods is a different story entirely. Food delivers potassium alongside hundreds of other compounds that moderate how your body absorbs and uses it. The best sources are sweet potatoes. One medium sweet potato contains around 900 milligrams. Avocados are another excellent source. Leafy greens, salmon, beans, and lentils round out the list beautifully. Most seniors are getting far less potassium than their bodies benefit from. Simply adding a sweet potato or half an avocado to your daily meals is a meaningful step. The fifth step is consistent aerobic exercise. And I want to be clear, the research on this one is genuinely remarkable. 30 minutes of moderate aerobic movement, 5 days a week, has been shown to produce meaningful reductions in systolic blood pressure without significantly lowering diastolic. It also stimulates your artery walls to produce more nitric oxide naturally, which over time supports better arterial flexibility. The standard used in most research is brisk walking, comfortably fast enough that holding a full conversation takes a little effort, but you are not struggling to breathe. 12 weeks of consistent aerobic exercise produces measurable changes in arterial stiffness, not just in the numbers, in the actual wall of the artery itself. That is powerful. Now, I want to say something about monitoring your blood pressure at home, because there is one habit change that I think makes a real difference in how useful your readings actually are. Most people check their blood pressure mid-morning or after activity and bring that single number to their doctor. But the reading that gives you and your doctor the most useful information is the one taken in the early morning, before medication, before coffee, after 5 minutes of sitting quietly. That morning window is when your body is under the most natural cardiovascular demand, and it is often the reading that tells the most honest story about how your blood pressure is actually behaving day to day. Try taking 3 readings, discarding the first, and averaging the last 2. Do that in the morning and in the evening for 7 days, and bring that log to your next appointment. 7 days of morning and evening readings is far more meaningful than a single number taken in an office. And when you look at those readings, watch both numbers. If your bottom number is consistently below 65, that is a conversation worth having with your doctor directly. There are also a few specific tests worth asking about at your next appointment if you have not had them recently. A urine albumin test checks for very early signs of kidney stress from blood pressure changes that can appear years before standard kidney function tests pick anything up. An echocardiogram can show whether the left side of your heart has had to work harder over time in response to arterial pressure, which is helpful early information. And a coronary calcium score gives a picture of how much calcification has built up in your arterial walls. None of these tests are experimental. They are widely available. Doctors simply do not always order them automatically, so it is worth asking. Here is the most important thing I want you to take away from today. Your 2 blood pressure numbers together, and the gap between them, are telling you a story about the health of your arterial walls. Understanding that story puts you in a much better position to have a productive conversation with your doctor, not to replace their guidance, but to build on it. You can ask the right questions. You can bring a meaningful monitoring log. You can discuss whether the specific habits we talked about today are appropriate for your situation. Your doctor is on your side. They simply have limited time at each visit. The more clearly and specifically you can describe what you are experiencing and what you want to understand, the more useful that conversation becomes for both of you. Pick one of these 5 steps to focus on this week. Whether it is adding beets or arugula to your meals, starting a short daily walk, or beginning to monitor your morning readings consistently, start with 1. Build it into a habit. Then add the next. Small, consistent changes are what create meaningful results over time. If this video helped you understand your blood pressure numbers a little better, please give it a like. It only takes 1 second, and it helps this reach another senior who might benefit from it just as much as you did. And if you aren't subscribed yet, hit that subscribe button right now and turn on the bell icon so you never miss a video. Every week I cover health topics that genuinely matter for people over 60. Things your doctor may not always have time to explain. Take care of yourselves, and I will see you in the next one.